Welcome. Check it out with Jessica Lee. I'm here with Brian Larsen, who is the VP of Customer Success from Practise Fusion. Brian,
Jessica.
Welcome to the show.
Thank you. Thank you for having me.
I would love to hear more about Practise Fusion because I've never heard of your company, and I know you're part of a bigger company now. What's happening?
We are. Well, first I want to say thank you for inviting me to this forum.
Sure.
It's not often we get to sort of discuss what we're passionate about in our careers and not bore our friends and family to death. So I appreciate the opportunity to do it in this forum. Practise Fusion is the #1 cloud-based EHR in the market. We're focused on independent providers and helping them thrive.
What is EHR?
So EHR stands for Electronic Health Records.
Okay.
And you can think of it simply as the electronic version of a doctor engaging with the patient. So
Okay.
everything from booking an appointment to checking in a patient to charting the patient's visit, maybe sending out for a laboratory result or a blood test or prescribing a medication, billing insurance and following up with the patient. That's all done electronically through Practise Fusion.
Okay, yes. Instead of paper and pencil in the old way, everything is now computer digitalized.
That's exactly right. So it's a great efficiency tool and opportunity. It is not the case that all medical professionals are using an EHR, but we're trying to help change that.
Okay, and you focus on the small practitioners, like the small, like one doctor with maybe an admin.
That's right. So the majority of our customers are small, independent practices. It's often 1 to 2 doctors and maybe 1 or 2 admin staff per doctor. I want to be careful here because we have practices that are entirely nurses, nurse practitioners. It's not just doctors. We call them providers because it's a function that they provide in the medical community.
Okay.
But yes, we focus on the small independent practices. There are EHRs that focus on hospital systems. You've heard of maybe some of the larger ones like Epic and Cerner. And there are others that focus on large practices, say 50 docs or 100 docs, these giant office buildings with lots of doctors in them.
Yes, yes.
Our product focuses on the small independent practices, so the 1 and 2 doc practices that are serving their community and choose to do so.
Right. And you're doing pretty good. You've got over 95% retention rate.
That's right. Practise Fusion has a 10-year history, 11-year history in the EHR space. We were a free ad-based product. We transitioned to a subscription model, which is standard in the EHR space. We've come through our first year of subscription model and are retaining over 95% of our customers. So very satisfied with our customers understanding the value that we provide and the relationship we're trying to build with them.
Right. I mean, I imagine doctors are really focused on taking care of the patient. They don't want to have to deal with IT applications and stuff, right? So you make it very convenient for them. That's
right. That's the goal. So we're kind of one of our focuses is being aligned with the doctors and being the partner in this space. So both Practise Fusion and the provider are focused on successful patient outcomes, right? And so in as much as we can provide an efficient tool for them to achieve that, that's what we're trying to do. So. Like I said, they have a very small staff, and so the staff are often wearing multiple hats. They're doing billing, they're doing scheduling, they're doing a lot of the IT work around. So Practise Fusion as a SaaS-based software is in the cloud. It can be accessed from anywhere. We spend a lot of effort in making sure it's intuitive and has a workflow that is compatible with their practice and can be customized to their practice based on their specialty, so that the IT, they're really outsourcing the EHR IT to us as well as part of their subscription price.
So what are the challenges that you face with the customer success journey for your clients?
It's a good question. Customer success department's pretty standard in SaaS software technologies, right? It's sales, onboarding, customer service, technical support, and relationship building through account management and retention, churn reduction, right? The typical cycle. The challenges we face is that our customer is different from a lot of customers. So you can imagine someplace, and they say you're a shoe delivery service, right? You get the shoes and they're the wrong size, the wrong color, the package was damaged, they show up late. There's a set number of things you need to do to get those products back, exchange the product, et cetera, give a refund. Our customer is dealing with people who are having medical issues or are doing preventative care. Yes. They need help, and the doctors are focused on helping them. Anything that impacts their efficiency impacts their ability to achieve the best patient outcome possible, and that is our shared goal. So the challenge that we face is our product is very important for our customer to achieve the outcome that they're looking to achieve. It also has an import bigger than just shoes, right? It's actually about patient health of the citizens of this country. Secondly, though, our customer being a small independent practice, they're very entrepreneurial. You can think of them like a co-founder or a founder of a startup, like here in Silicon Valley. So they've decided they didn't want to be a part of a large practice. They decided they didn't want to be part of a large hospital. They wanted to hang out their own shingle, or maybe they bought a practice from a relative or a colleague. Some of them are coming out of medical school and always have had this vision to serve this population as an independent practitioner. And so they're entrepreneurial. And that means a few things. One, their margins are small. And you hear this all the time in Silicon Valley, right? We got to understand our run rate. We don't want to get ahead of our skis. They're very much thinking in the same way. Another way that they're sort of entrepreneurial in that way is that like I mentioned, they're wearing a lot of hats, right? So different staff are wearing different hats, and while they're getting going, and while they're starting to be trying to be successful, and that poses some challenges. Any time away from their practice is inefficiency, as I mentioned. So understanding that customer is really the focus that I have in the customer success space. It is, of course, all the metrics around that cycle of sales, service, onboarding, retention, churn reduction. But more than that, it's understanding the customer and how we adapt our approach to meet that particular customer's need given the import of their work.
Okay. Brian, I find that it's very convenient for me as a patient when I move from one healthcare provider to another. As I change jobs, I have different healthcare providers. And so what you're doing is fantastic from the consumer point of view and from the doctor's point of view.
I think that's right, and that's one of our primary focuses. So I think we're seeing a couple of trends in the industry. There's a lot of trends, but a couple that stand out to me. One is that we're seeing consolidation in the market, so in the EHR space specifically. So 5 years ago, there were many more EHRs than there were 2 years ago, and more than there are today, or fewer and fewer EHRs. This is true for a couple of reasons. One is that the being certified and complying with regulatory authority in the federal government and the state government, it is difficult work, and it's expensive, and it requires expertise. And so that's harder and harder to do for companies like ours. The other reason we're seeing consolidation in this space is that it is a difficult challenge to provide both the base EHR, like the standard functionality that any doctor would need, and also the ability to customize that EHR to fit your specialty. So the work of a psychiatrist, vastly different from a homeopath, from an acupuncturist, from a chiropractor, from a podiatrist, etc. So having a standard certified regulated EHR plus the customization, that's a hard balance to strike. So if you are a podiatrist-centric EHR, you're going to need to get a lot of podiatrists to be successful and to sustain yourself as an EHR. So consolidation is happening for a variety of reasons. The other is that I think in the health IT space, there's a lot of technology specialties, right? There are people who do EHR, there are people who work particularly with health insurance, with pharmacies, with laboratories, with imaging centers, et cetera. And I think a lot of those businesses, we're seeing them concentrate on their expertise and develop that interoperability and that connectivity that you're talking about, so that when you change, your information goes with you. We're seeing that both on a small scale and a large scale. So statewide registries, what we call HIEs or health information exchanges, are becoming more and more prevalent. And that is, states want to understand the health of their population. Yes. So they're working with EHRs like Practise Fusion to have patient information all anonymized. PHI and HIPAA compliance is very important in our industry. But the state gets a hold of the information of the citizen population so that they can spend their money, the taxpayers' money, to make health outcomes for their state's citizens better. So yes, that interoperability and that information exchange, that connectivity is a very important thing for Practise Fusion. It's also something that our business unit in Allscripts, Veradigm, is working on. So it's fairly similar. Our focus is fairly similar, achieving better outcomes between Practise Fusion and Veradigm. Practise Fusion, again, the small independent practice. Veradigm is working to simplify and to get better outcomes by leveraging technology to create efficiencies and reduce cost across all of health IT. And so that's the health insurance companies, that's the laboratories, that's the pharmacies and the pharmaceutical companies, and the practices like the ones Practise Fusion serves. So we're really embedded in a larger business unit that shares the same focus, but different scale.
Right, just for the audience to understand, Practise Fusion is part of Veradigm.
Yes.
Veradigm is part of Allscripts.
That's correct.
And so it's part of a multi-billion-dollar company in the end. Besides the current trends that you're seeing, are there any new regulations that will be coming out that we're going through the discussions right now?
Yes, every year the government issues different regulations about different parts of how medical care is provided, and some of those are around practitioners who accept Medicaid and Medicare as insurance, right? So government funded insurance. They want to make sure that the patients are getting quality care and outcomes, and some of those are around the legal parameters for things like EHRs to make sure that we're compliant, so that when a doctor is using us, that we're following the federal regulations around prescription of controlled substances, around checking for conflict in medication, et cetera. So every year there are new regulations, and every year we work with CMS and other bodies in the United States to make sure we are not only fully compliant, but a partner with them as well. So that we can be successful and not be sort of just following suit.
Right.
Be a partner with them.
How do you make sure your agents, your customer success managers, are up to date and very technical from like policy point of view and technology point of view?
Yeah, so it takes a lot, right? So in our business, it is training customer-facing staff is an ongoing process. It happens every week. We have release trainings. We have certification trainings. We have informational sessions every week. We had one yesterday that staff are attending. So the way we do that is we hire experts. And we have experts on staff that are well-versed. They serve on national boards. They are well-versed in all the aspects. We also have legal counsel, obviously. We invest a lot in sort of making sure that we have all of our bases covered and that we're engaged.
Right.
It's not just to receive and respond. It's an ongoing conversation, so we're in lockstep with the requirements we're gonna have to meet.
So in this case, the environment you're in, the product, and all the regulations require you to really have in-house customer success teams, right?
Yeah, I mean, I'd say that the customer success teams are the voice of the position of the company, right? So we're having conversations with providers who are asking very in-depth and intelligent questions about regulations and how to make sure they're in compliance. Those customer success, those forward-facing teams, the ones that are having those engagements, are having regular engagements with the experts to make sure our language is clear, it complies with the regulations we're being asked to comply with, and gives the doctors, the nurses, the staff at these independent practices all the leverage of a large practice, a large hospital, through our technology and through our staff.
What are you most excited about?
Most excited about? I think, for me, I'm sort of in the customer-facing space, and you customer service folks, customer success folks will know this firsthand. If change doesn't fuel your battery, you're not going to make it. And so, for me, every day is different, and that's really exciting. When a day works out as I planned it, with the meetings hitting and all the things going right, I'm worried something's wrong, because it's that rare, right? So I'm excited about tomorrow and the next day. I definitely, I subscribe to a continuous improvement philosophy. That is, if you're not getting better, you're getting worse. There is no standing still. So every day is an opportunity to become closer with our customer. Every day is an opportunity for our staff to grow and have professional development, and for us to have an impact in patient outcomes. So I'm excited by every day.
Great. Well, I've learned a lot talking with you, so thank you for being on the show and sharing with me and sharing with the audience.
Thank you. Thanks again for having me.
Sure. There you have it, folks. Take it up with Jessica Lee, Brian Larsen from Practise Fusion.